This was a 3-year follow-up, and the 3-year follow-up was very significant, showing that the progression-free survival with venetoclax and rituximab continued to hold very well at about approximately 71% versus bendamustine and rituximab, which is I think about 17%. So again, and then the other follow-up was looking at all of these patients stopped venetoclax at 2 years. So this was a follow-up to look at minimal residual disease with venetoclax therapy. And so they broke the data down looking at undetectable minimal residual disease, low minimal residual disease, and high, meaning a lot of disease left. And there was a very significant correlation between those folks who had undetectable disease were still in long-term, meaning did very well after stopping therapy. So one question, of course, that arises from this data is 2 years of venetoclax enough? And I think there is a question for the patients who still have a lot of disease present at the time of stopping. There were more relapses in that subgroup. The PFS curves still look great, but there's no doubt that the patients who have high levels of minimal disease are still going to relapse, or potentially still relapse. And so one may think, are those the folks that we should continue therapy longer? And so I think that still remains a question. We're going to need longer term follow-up on this data to see how the PFS curves hold up, and whether there are subsets of patients that break out that we might consider continuing therapy longer than 2 years. But the majority, I'd say, very well with this 3-year follow-up data. I think that patients can. I think this is a very good study to show that you can do fixed durations of therapy with a drug like venetoclax.